Now, as far as offering the rapid test as an option, how accurate are they?
Well, people get confused right now, but it's issues of sensitivity and specificity, which at the end of the day, accuracy and positive predictive value is going to depend on prevalence of disease. So if you're symptomatic, those tests are actually pretty good.
Okay.
If you're asymptomatic, they may have false positives and false negatives. There tends to be more false positives than false negatives. In other words, if you remember, there was the governor of Ohio who was tested with a rapid test, and when the president was going to go see him, and then he got retested with PCR, was negative. So if you test positive on a rapid test, getting a PCR afterwards is recommended. It's a good practice. So now, if you're negative, could you still be positive? You could be, but the chances diminish significantly. A lot of this test, because of their sensitivity, is not perfect. If you see, for example, and again, I want to talk one brand, which is the one I know the most, the Binax Now test. If you go buy them, you'll see that they sell you two tests. It's not for you and your partner to be tested. It's for you to be tested twice. You test today and you test 24 hours later. So I'm going to go to a thanks, because if you do that back to back, you significantly increase the positive predictive value of the test. So if I'm going to go to a family gathering on Thanksgiving, I'll buy my test Monday, get to test day Tuesday and Wednesday. And if I'm negative, I'm fine Thursday, right? So, I mean, there's ways to do two consecutive tests are much better than one. So it's not a straightforward answer there about sensitivity and accuracy.